Hello. www.strokeupdate.co.uk reporting to you from the American Heart Association's International Stroke Conference. It's held in Honolulu in America. Now, one of the research that was discussed earlier on today is about the concern that was raised regarding e-cigarettes, as these types of cigarettes increase the risk for stroke and heart attack and coronary heart disease. The other research showed that the main question for that research actually was whether dual antiplatelets with cilostazol in combination with aspirin or clopidogrel reduces recurrent ischemic stroke in patients with high-risk stroke. And the conclusion is that dual antiplatelets reduced recurrent ischemic stroke by 50%. The other research that was discussed today is about e-cigarettes and about reducing the blood pressure and for the patients who are presented with ischemic stroke. But first with the e-cigarettes. So the International Stroke Conference raises concern that e-cigarettes increase the risk of stroke and heart attack, as I mentioned this. But then with the hypertension, rapid blood pressure lowering, safe for stroke patients. And this is what the NIHR supported study has found. This is Enchanted study, which showed that rapidly lowering blood pressure safely reduces the risk of bleeding in the brain for patients treated with clot-busting drugs, though we need to understand better why this did not lead to overall improvements in recovery at 3 months following stroke. And this is an important piece of work that was discussed today. Again, another research, stroke survivors have better quality of life 3 months after their stroke if the clot was mechanically removed, even hours beyond the ideal treatment window. And this is research from Stanford University School of Medicine. Explained the findings from her research in the conference today. In another research in the conference, in a single group trial, 352 patients with acute major bleeding while taking a factor 10 inhibitor were treated with andexanet. Andexanet markedly reduced anti-factor 10 activity, and 82% of the patients, according to this research, had excellent or good hemostatic efficacy at 12 hours. Very good piece of work. Andexanet for bleeding related to apixaban or rivaroxaban, for example, factor 10 inhibitors. We'll speak to you again. This is Dr. Amir Jaffer from strokeupdate.co.uk.